Hello everyone, I'm Martin. I'm part of the Media Access Marketing Department for SCAA. Welcome back to our AEP session. Those new to our channel, welcome. You know what to do, and click that subscribe button and give this video a like, as it will help move our platform forward so we can continue spreading awareness to the general public about sickle cell disease through our social media. Also on our channel, you can watch previous AEP sessions that you may have missed before, so make sure to go check that out. I also want to say to continue practicing social distancing, washing your hands, even though a lot more people are getting the vaccine. Today's session features Kim Major from UC Benioff Children's Hospital in Oakland. Kim Major will be talking about why transition from pediatrics to adult care is important, what is healthcare transition, pediatric versus adult models of healthcare, and why planning is important, as well as tips to learn about the healthcare system, and so much more. Without further ado, we welcome our speaker, Kim Major.
So this is the slide that I was talking about, why transition is important. And as you see, there is sort of a lifespan of babies all the way through toddlers, adolescents, teens, young adults, and then we have a wonderful elderly patient here. And here we go. And then I can just repeat this. So this, again, is the formalized definition of what healthcare transition is. So the purposeful planned movement of adolescents and young adults with chronic physical and medical conditions from child-centered healthcare to adult-centered healthcare. So transition is a process. So a lot of times our young adults think that, they're just going to hit a specific age and then they'll automatically be transitioned into the adult sickle cell program. And that is not the case. We want to be able to implement planning, various stages, lots of communication, discussion, not only with our young adult, but the caregiver, whether that's an aunt, uncle, grandmother, cousin, and we want to make this process as smooth as possible. So again, it's planned, it's starting in adolescence, and then it's moving into adulthood. And it not only addresses the patient's medical needs, but it also is encompassing of their psychosocial needs, their education, their vocation skills. So what does transition have to do, or health, have to do with transition? And you see I've bolded everything in red, because your health, it impacts all aspects of your life. So whether you're just a student, you need to maintain health to be able to be successful in the classroom, within the community, if you're employed, or friendships, relationships within your family. So all of these aspects combined require that young adults with sickle cell maintain a healthy life. And so in order to do that, it's important for our young adults to be able to, one, understand their condition and what's happening to their body, as well as be an active participant in their healthcare and their healthcare decisions. So what does the data actually tell us? And this is one of the reasons why transition planning and education and support has come about, because there were several studies that were conducted in the state of California and elsewhere that actually demonstrated and showed that there is an increase in healthcare utilization and mortality in patients, specifically with sickle cell disease, after the age of 18. And so I just threw this next slide in. You don't have to try to dissect it. But again, this just further validates and shows us that in population-based studies, again, between the ages of 18 and 30 years old, sickle cell patients had the highest ED utilization rates and return to the hospital post-discharge. So that simply means that between the ages of 18 and 30, there's something that's actually happening. We know that this is the identified age of transition age youth. So we really feel like between 18 and 30, our young adults are not coming in to be seen for routine regular health care. They're somehow becoming lost.
You got paper over your phone.
I'm sorry, did someone have a question?
do you mind muting yourself, Edward?
Yeah.
Thank you.
Oh, sorry, I thought someone had a question. So again, so there is something definitely happening with this specific subset of young adults. And again, it's very important.
Hi, Marilyn, do you mind muting yourself?
So it's very important that this particular group of patients are able to acquire the necessary skills to navigate the adult healthcare world and get in to either a hematologist, a sickle cell specialist, to be able to continue to have their healthcare monitored. So here, this particular slide looks at the transition goals. And again, we've already indicated that transition needs to be uninterrupted. It's patient-centered, meaning that we really want to focus on the patient's needs. It needs to be flexible. It should be comprehensive, meaning not just talking with the specific patient. The medical provider needs to be involved, the nurse practitioner. If there are any mental health needs where the patient is experiencing depression or anxiety, the social worker or the psychologist needs to be involved. So it needs to be very comprehensive and then also developmentally appropriate. And just because some of our teens may be 18 or 19, that does not mean that they're developmentally mature and ready to be transitioned. So there's, specific one-on-one work that the social worker provides to patients to help get them prepared. And again, here, this is another slide that just talks more about the goals. So we want to be able to maximize the independence and social connectedness of our young adults, making sure that if they want to further their education after high school, going into college or a vocation program, we want to be able to connect and link the patients with specific resources to ensure that they're able to further their education. It's important that we are talking with our young adults about medical competency and responsibility in order to prepare them for healthcare transition into the adult program. So again, this slide really reiterates best practices in transition and what should be happening along this particular process. Again, ongoing engaging of the patients, their parents and the caregiver, the educational team, the medical team, and all of the service providers through ongoing collaboration. Really, transition is based on the patient's needs, the strengths, the interests, and their particular preferences. And we want to be able to provide patients with overall self-determination and self-esteem to know that they can become independent of their parent or care provider at some point in their healthcare needs. Actually just put this slide in, which sort of really looks at the pediatric versus the adult model of healthcare. And if you'll see on your left-hand side, pediatric healthcare is really driven by the provider and parent. It's very comprehensive. So there are a lot of team members that are actually involved with pediatric healthcare. And if you will, we sort of have coined the term one-stop shopping. So you can get all of your healthcare needs met within a pediatric healthcare setting. There's lots of social work support. And again, families are provided with lots of support throughout the entire process. On the other side, the adult healthcare world, it's very patient responsible and patient driven. There are multiple providers caring for each separate health issues. In contrast, again, in pediatric healthcare, you have multiple team members there under one particular umbrella, under one roof. And it's really in the adult healthcare world, the patient's responsibility to be proactive and to get their needs met. And there is, of course, social work support. So what's the same? So this slide is very specific to our sickle cell program at Benioff Children's Hospital, Oakland, which may be similar to other sickle cell programs across the country or state. But what remains the same for us or for our young adults after they have transitioned into the adult program is that they will continue to be followed in the outpatient sickle cell clinic. And they're able to check in where they usually check in because again, our program is really unique in that we have an adult program and a pediatric program under the same roof. And so really our patients are going from one side of the clinic to the other side of the clinic, which is literally maybe about 20 feet. The clinic days and times operate still the same, Mondays and Wednesdays. There's still access to the day hospital for transfusions and pain management. And then patients are able to get some x-rays, some labs, and they do have access as adults to our outpatient pharmacy and some outpatient testing like echo, squids, and DEXA scans. Now, what is different? So after you're officially and formally transitioned into the adult program, you will be required, because of insurance changes, what is called a primary care physician or a PCP. And healthcare in the state of California has really changed in the last few years. I would say maybe about 10 years ago, the Medi-Cal system that I'm referring to has changed. So patients were primarily all assigned to what's called straight Medi-Cal, and their care was uninterrupted. They did not need an opt-in referral to be seen at the sickle cell clinic. They could just schedule an appointment and come in. With the way that now insurance has changed, it's more operating like an HMO. And so Medi-Cal has moved to what is now called managed Medi-Cal plans, and patients are actually assigned their Medi-Cal benefits via the county that they actually reside in. And so what is now required is that when you become an adult, you must establish care with the primary care physician, let them know that you have a chronic health condition and you'd like to be seen at a specialty care center, and you have to request what is called a referral. So without the referral, you're not able to be seen at the sickle cell clinic. Any questions so far? Okay. What is also different, once you actually are formally transitioned into the adult program, you would no longer obviously be admitted to a pediatric facility. So you would actually access care in emergency at one of your local hospitals. And here are some of the local hospitals that some of our patients access regularly or utilize regularly: Alta Bates in Berkeley, Summit Hospital, Highland Hospital as well. I didn't list that one, but that's another hospital here in Oakland, California.
Excuse me, I think, Noah, did you have a question or did you raise your hand?
Yes, just wanted to know if there was an age difference or start if you wanted to change into care.
Yes, so we're actually going to talk about that, but to answer your question right now, it's age 21. You mean to transition into the adult program? Was that your question? I just want to make sure that I heard you correctly.
Yes, ma'am, that's correct.
Yes, so age 21, and we'll also talk about that a little bit later as well too. And I apologize if some of these slides are a little bit redundant, but again, it's very important that we're sending the message regarding what is a requirement and what is the foundation for a positive and successful transition. Again, we need multidisciplinary collaboration across the board. All of the team players that are involved in your care needs to be a part of your transition process. Early identification of patients, and we'll get into these slides a little bit later. So early identification of patients, transition planning, patient and family engagement, transfer of information. We'll talk about that a little bit later, making sure that things are family centered, it's gradual, it's developmentally appropriate, And we want to be able to address the common concerns of the young adult and their family members. Often I hear from our young adults that they're maybe fearful or concerned going to a new healthcare provider or a new team that does not know about sickle cell or that does not know them well. Again, one good thing about the program at Children's Hospital is that the team members are very familiar and very astute with caring for individuals with sickle cell disease. The other concern or thing that I really actually heavily promote to our young adults is finding out everything that they can about their health. What's their hemoglobin level? What to do when they have a fever, what to do when they have pain, who to call when they have pain. All of these particular aspects combined are going to make for a successful transition. So what does the successful transition lead to? So fewer gaps in clinical follow-up, improved access to care, decrease financial barriers, and that's a biggie. Again, we talked a little bit about insurance, but I cannot stress how important it is to be able to make sure that you are getting your insurance affairs in order prior to transition, because without insurance, you're not able to access care. And seeking emergency room, we all know that that's suboptimal care. That in the long term is not going to address any medical needs that is going on with you or your young adults. Successful transition also leads to improved adherence, so better pain management, fewer emergency room visits and hospital admissions, and overall improved quality of life. So again, these are just tips for transition. Again, learn about your medical condition. That's very important. And I always talk with my young adults and tell them that no question is a silly question. If there's something that is concerning you about your health, that you don't know about your health, or that you need a little bit more education or support around, ask the question. That's what we're here for, is to support you. Learn about the medications that you are taking, the names, and specifically what that medication is for. Why are you taking the medication? You shouldn't just be taking medications if you don't know what you're taking them for. Again, learning and knowing the warning signs could potentially mean that you might need emergency help. Yes, is there a question?
Yes, I wanted to ask a question. You know, you were talking about the team.
Yeah.
What if the team doesn't consist of all those people that
So
that are part of the team because of lack of resources or lack of, personnel? What happens
absolutely.
then? I mean, how does that work if not all those pieces are there?
Absolutely. That's an awesome question, Nadina. So if you are seeking care somewhere that does not have a full-on team, then you want to identify at least one person within that site where you are accessing care, whether it's a social worker, a case manager, even if it's a nurse or just the physician. You want to be able to identify a strong medical person or support person to be able to help navigate you through this system. If anybody is going through the transition process alone, that should not be happening. So
Yeah.
you want to be able to identify um, a doctor, a nurse, a social worker, a case manager, or someone to help you through this process.
Makes
Um,
sense. Thank you.
sure, absolutely. Other tips include knowing how tobacco, alcohol, drugs, smoking affect your health. And I'm saying young adults because this transition is who I'm always talking to, our young adults, about these specific things. But it's important for our caregivers and providers to know about this information as well. With this particular topic, drugs and alcohol, or smoking, I always let my young adults know, hey, look, I'm just your social worker. I'm not the police, but I do think that it's important that you are going to be doing any of these things, please do them in moderation, because in the long term, they can have adverse, side effects on your overall health. And it's also important to be able to get the proper amount of sleep as well. Sleep helps restore your body. So this slide really talks more about learning the healthcare system. It's important for young adults to carry a list of addresses and phone numbers of your physicians. And why this is important is because, most of the young adults that access care through our program, we've known them since they've been born, these little babies, toddlers, and have grown up. But I always give an example or a scenario. Now that you're a young adult, you may be traveling, you may be out of the state, and those medical providers don't know who you are. So it's important to be able to have the phone numbers and names of your physicians so that if you end up in the emergency room out of state, you can provide those medical providers with the contact information, and they can consult and collaborate with your sickle cell doctors about an appropriate plan for your care while you're in the ER or if you're admitted out of state. Know who to call in case of emergency and how to call them. Learn to make your own medical appointments. And I encourage my parents to always, at some point, allow the young adults to be able to call for either their prescription refills, scheduling or canceling their appointment, because what happens is when you are transitioned into the adult program, you're actually the identified patient. And so the medical providers aren't going to be speaking with the parents or the care provider any longer unless you have signed a formal consent that will allow the staff to consult with your caregiver, parent, guardian. Okay. So it's good to get into practice of being able to do these things on your own. What else is important? Writing down questions before you go to the doctor's appointment. A lot of times when you get to the doctor's, your mind is racing, especially if you're not feeling well, things have been going on through the week. Have a little notepad. You can go to the dollar store, buy a pen and a notepad. So if there's questions that you have before you go to the doctor's appointment, you've already had them written down so you don't have to worry or stress about trying to think, oh my God, what did I have to ask my doctor? What did I have to ask my nurse practitioner? You can just refer to your little notepad. Okay. Talk to your social worker or nurse about questions. So in addition to your doctor, there's again other staff here at Children's Hospital. But as Nadina brought up a good question, if your center or where you are accessing care does not have support staff, yes. Is there a question? Sorry, I thought I heard a question. So you want to be able to, again, identify someone that you can talk to about your questions or concerns. Again, we talked about being able to call for your own prescription refills, carrying a copy of your insurance card. With this one, I know this is hard because a lot of parents are like, well, I don't want to give them a copy of their insurance card because I'm fearful that they will lose it. Make a copy. It's important that our young adults actually have a copy of their insurance card. Again, because if they're out of state or they're traveling somewhere, if they present to the ED, that's one of the first things, unfortunately, even though you're not feeling well, you're in pain, what insurance do you have? Do you have insurance? And let me have your insurance card. Also, please learn about your health insurance. What type of health coverage do you have? Do you have an HMO? Do you have a state insurance? Do you have private insurance? And so here I've just listed several types of insurance. Again, we've talked a little bit about the Medi-Cal Managed Plan, and these are some of the specific plans. There's Alameda County, there's Alameda Alliance, there's Blue Cross Blue Shield, there's CCHP, which stands for Contra Costa Health Plan, there's San Joaquin. So again, it's important to be able to know which insurance you have. And I think in my last presentation on last year, we also talked a little bit about transition, or excuse me, about GHPP, but I've also included GHPP again in this presentation because it's very important. A lot of patients don't take advantage of applying for GHPP, but it is an insurance that every patient over the age of 21 becomes eligible for. So even if you're working, you're not employed, you are eligible for GHPP benefits. And what GHPP is, it's a state-funded insurance that is very similar to Medi-Cal, and it's just specific to individuals that have genetic blood disorders such as sickle cell. And there is an application process. You are required to submit either your California ID or driver's license and proof of residency and proof of income. Now, what GHPP will cover are some medications. It will cover some labs, some tests, part of hospitalizations if you're admitted to the hospital, as well as DME. So DME are durable medical equipment. So if there's bars, if you're having trouble getting in and out of the shower and your shower stall needs to be equipped with handles so that you can get in and out more safely, toilet risers. So that is what DME is. So I encourage all of my young adults over the age of 21 to please apply for GHPP. If you would like to do so, you can Google the application and it'll come up in PDF form. You're able to fill it out online. However, you're not able to submit the actual application online, unfortunately. So once you input all of your information, you have to print it, and you can either fax it or mail it in. I always recommend fax. Fax is much faster. And then you also have a way of guaranteeing that they receive it because you'll receive the fax confirmation receipt that they got it, okay? So I would encourage and employ all of our young adults over the age of 21 to
I have a
apply.
question, Kim.
Yes.
This Medi-Cal managed plan,
Yes.
can you explain how there's all these different parts like Alliance and Blue Cross? How do
Yes.
they determine who gets what? I mean,
So
how's that worked?
So patients are actually assigned by the county that they reside in. So if you live in Alameda County, you're going to by de facto be assigned to Alameda Alliance or Blue Cross. So with Alameda County, there's Alameda Alliance, and then there's also Blue Cross Blue Shield. But for CCHP, that stands for Contra Costa Health Plan. So if someone is living in Antioch, Concord, they would automatically be assigned to CCHP. Or if they're living in Modesto, it's San Joaquin County. You're muted.
I'm sorry.
That's
So that means that they can, depending on where they live, that's where they have to seek care. They can't go out of that county. And if that county doesn't have any care, then what happened?
Good question. Good question. You have all the wonderful questions, Nate. So yes, that is an awesome question. So what happens in that particular instance is that Medi-Cal has something that's called MER, which stands for Medical Exemption Request Form. And so patients, it's a 3-page application, if you will, that patients are required to fill out the first page, and then the medical provider, and usually I'm doing it for our medical staff, our nurse practitioner and physician, I fill out the second page, which verifies that yes, the patient has a chronic health condition. We have to write in the diagnosis. We have to put in some codes, have the doctor sign it and submit it. And the only thing about that, it is useful, but it only lasts for 12 months. So at the end of the 12 months, patients have to reapply to, for eligibility to be seen outside of their county.
Okay, and so in your presentation, is that information, what you just talked about, is that anywhere in your presentation? Because I guess my next question is, how do clients know that?
They don't. And
right.
And I did for years. I didn't know that for years until I had come upon a specific, very difficult case, maybe about 10 years ago. And so I had to call Medi-Cal and research this myself. But Medi-Cal doesn't readily tell you that information. And the forms are actually online, which I eventually found that out as well too. And if you just type in capital M, capital E, capital R, MER, again, you will see that the medical exemption request form will come up, and you can just download that and take that to your primary care physician, or yeah, they can take that to the primary care physician.
It's MER.
MER.
MER. Okay. Thank you.
Sure.
Great. Good info. Thank you. Okay.
Absolutely. And so again, it's valid for, I'm sorry, go
I
ahead.
had a question, similar to Nadina, but let's say like we are in Alameda County and we wanna, but then later, let's say we're in a different county for vacation or whatever, and we are in pain and we have to go to the emergency room, and we have to go to that emergency room in a different county. So how would it still be okay? Like, how would that work? Because sometimes with HMOs, they give us the hard time with that.
In those particular cases, those the services that were rendered out of county are covered, because you can't help an emergency situation. And it's not the expectation that someone drive from one county to the next just to be in the
Right.
specific county that their insurance is to get medical help. So I would encourage anybody, if you're out of your assigned insurance county, go to the closest hospital. You don't want to risk further complicating or exacerbating your existing condition, just trying to get back to your county that you're assigned your insurance in.
Okay.
And does
I'm
this apply
sorry.
to also out of state? Oh, sorry.
Yes,
Sorry.
so that can somehow be tricky. What happens is when you are out of state, typically if you seek emergency care is covered. If you get hospitalized, just a percentage of that is covered, so not the entire hospitalization.
Okay. What does MER stand for again? I'm sorry.
No problem. Medical exemption
Oh, exemption
request.
Okay, because I looked online and I got MER, but they're talking about primary care conferences, medical education resources. So cool. All right, great. I got it.
I can email you the link.
Fantastic. That'll be
yeah.
great.
Yeah.
Okay.
I just completed 2 of them last week, so I can email you the link. Oh, you're right. Yeah, I don't know why that came up. So yeah, I can email you the link, okay?
Kim, I also like dropped the link in the chat. If you can double check that, just make sure, like, is that the form? That's what I found when I Googled it.
Okay, let me get out of here. You just go to chat. Sorry, my service is
That's
moving
okay.
slow here.
Sure. Thank you, Nina, for that GHPP link as well.
You're welcome.
Yes. This is it. Yes.
Like all the way to the bottom.
Is everyone able to see this?
Yeah, we see it.
Okay. Yes. So this is the actual form, and you would take this to your physician to complete. Awesome. Nina, thank you so much for sharing that link. I appreciate it.
Hi, Kim. Ms. Major?
Yes. Yes.
I thought it was funny on that form. I saw when you were scrolling, it said you can use this method until your medical condition is no longer a problem.
So for patients that have sickle cell, obviously we know that that is not applicable. On the form, again, it does require a diagnosis and a specific medical code. And so when the form is actually submitted back to the Medi-Cal office, the head Medi-Cal office in Sacramento, they are aware that this condition is not, that it requires ongoing treatment and care.
Okay.
Yes,
I figured as much, but it sure would be nice if they would, add that disclaimer for people that don't pay attention to it or, panic
right,
or think they can't even use it. But thank you.
right. Absolutely. You're welcome. You're welcome. Any other questions?
Yes, Noah has a question.
Sure.
Yes. In the event you have multiple diagnoses, can you fill that in on that form too? Or should we just stick with the main diagnoses?
Well, it depends on where you're wanting to get care. So what I would recommend, if there's multiple diagnoses that you are requiring multiple specialty care for that's out of your assigned county, is to complete, because each form is specific to one provider. So I would recommend that you complete either 2 or 3 forms, because each one will need to be completed by that specific provider.
Thank you.
You're welcome. Any other questions regarding insurance and Medi-Cal? Okay, so we'll continue with our presentation. This slide here really talks specifically, and the next few slides will really talk about the transition program, again, at Children's Hospital Oakland. And again, I'm sure that some of our program's transition policy is applicable to other programs that are out of state or, yeah, out of the state. So there's 6 core elements of transition. Again, there's transition policy, transition tracking and monitoring, transition readiness, transition planning, the actual transfer of care, and then transfer completion. So here is a copy of our actual transition flyer that I developed along with our psychosocial team, including our pediatric sickle cell social worker who's no longer with us, and our psychologist, Dr. Marcia Treadwell. Initially, years ago, when I started talking with patients and families about transition, it was sort of this very vague and ambiguous term, and a lot of families were like, well, Kim, what are you talking about? What is transition? Where's my child going? Where are you sending my child? And so I wanted to be able to provide them with sort of a handout that they could take after the appointment, go home, sit down, relax in their comfy confines of their home, and review, like, what does transition entail? What does it mean? What are some of the things that you and your child together need to begin to think about to help them prepare to moving from child-centered healthcare into adult-centered healthcare? So this is like a trifold pamphlet. It has all the numbers of our medical staff, our social worker, our psychologist, and then on the inside, it also has things like important phone numbers, resources to like community vocational rehabilitation services, Social Security, paratransit, if you're in need of transportation to get back and forth to your appointments. And then it also has little blurbs and excerpts that really spark thoughts that our young adults need to sort of begin to think about in their transition planning. So our policy specific to Children's Hospital in Oakland is that at age 12, we provide our patients with the transition brochure. Then at age 14, we actually administer what is called the transition readiness. So it's the little form that you see on the right. And this is just a page out of the actual checklist that I've included in here so that you can just sort of get a thought or view of what the actual checklist looks like. So the social worker sits down with the young adult and reviews all these various domains with the patient. Was there a question? Okay. So the assessment reviews or assesses the patient's medical self-care, whether or not they have social support, their knowledge about healthcare benefits, plans for future independent living. We also talk about education, employment, and vocational skills. And again, really this particular checklist is helpful to both myself and the patient to help determine the areas and skills and strength that they either need to grow or that they're all already very knowledgeable in. So each year after the age of 14, we review and review, sorry, and revisit the transition checklist. And we'll see where we are. So maybe at 15 or 16, we really weren't knowledgeable about what our healthcare benefits were. But now at maybe 16 and a half or 17, there's been some work and we know what our benefits are. We actually carry a copy of our insurance card.
Excuse me, Diane had a question. Is Benioff transition policy available online to print out?
It is not. We don't have the policy online, no. Sorry.
Is it available to use for our own efforts in San Diego at an adult sickle cell disease clinic that's part of the Networking California for Sickle Cell Care initiative?
Well, so what I would recommend, we've sort of extracted, our policy has changed and morphed over the years. And so we've engaged in several different policies. Initially, we've changed them. And each year, I think every 2 years, our policy has changed and looked different. And so we're now at a place where this last year, it's even different probably than the previous 3 to 4 years ago. And I'm saying all that to say that one really awesome resource that we utilize and have extracted a lot of our policy information from is an online resource, which is called GHP Transition. They are a full comprehensive transition wealth of information knowledge. There's printable checklists, resources that you can use with your patients and families. And again, they are GHP Transition. Let me see that I add them at the, I'm hoping you can see this at the very bottom. Let me see if I can make it bigger, the link. But if you type in GHP Transition, you will be able to find a wealth of knowledge.
Oh, thank you. I do know about God. It's just so many, you hear so many different things, and this is a good reminder about God. Thank you.
Yes, absolutely. You're welcome. So again, this is just an excerpt of one of the pages in the tools, the readiness assessment tool. And this particular question focuses on health. And the responses are, I know this, I need to learn, someone needs to do this, and if someone needs to do this, we identify who that person is. So some of the questions are, I know my medical needs, I can explain my medical needs to others, I know my symptoms, including ones that I quickly need to see a doctor for. Excuse me. I know what to do in case I have a medical emergency. I know my own medications, what they are for, and when I need to take them. And then I know my allergies and medicines. And so again, this tool is very useful in sort of helping the young adult really think about what it is they need to be thinking about and how they can become more independent in their healthcare behaviors. And I think a lot of times what happens is patients' parents are so used to just doing this for their young adults and older adults. It's just become a part of their lives. And they really think, okay, well, at some point, my young adult will do this, but for now, I'll continue to do it. But it really is important to allow the young adult to see that they can become independent, self-sufficient in managing their health, because at some point in their lives, they're going to need to be able to navigate the adult healthcare system independent of a care provider or a parent. Again, this slide just really shows us and points out more skills that our young adults need to be preparing for and practicing. So again, speaking directly to your medical team, meeting alone with your medical team. So part of our transition program is having our medical providers, so either the doctor or the nurse practitioner, whoever's seeing the patient, having at least 5 or 10 minutes alone with the young adult. And this also gets them in the mindset of becoming a young adult and eventually adult, talking to the healthcare provider alone. Or there may be questions or concerns that the young adult may have coming into the clinic room, but may not necessarily always feel comfortable talking about in front of their parent or caregiver to the physician or the nurse practitioner. Should also be able to, at some point, call the nurse yourself, make an appointment yourself or with the support of a parent or caregiver, managing self-care and medical skills, filling a prescription or medical supplies. You'd be surprised, a lot of my older young adults have never actually called to fill their prescription because, you know, mom, dad, or grandma, and uncle, or cousin have been doing this for them. So I always encourage my parents and care providers, give the young adult a chance, give them a task to be able to do this independently and then on their own. And of course, taking your medications as directed is important as well.
I want to comment, I think that's a great statement to get them to take responsibility for themselves. However, you know, you got to remember that follow-up because they got so much going on. It's hard for them to maintain and just keep up with everything that they're supposed to be doing. So yeah, that's really good. You really want them to become independent because ultimately it is their life and they, you know, need to manage that. However, you know, it's always nice to have somebody in the background just saying, okay, did you do that? Did you remember? Did you take your meds?
Absolutely.
No, because
absolutely. And that was my point too, not just having the parent or the caregiver throw the patient out there alone to just be independent in this process. It takes time. And again, transition is a process, not one single event. And so again, I encourage the patient or the provider, the caregiver, excuse me, or the parent to actually do this assignment along with the young adult, provide them some hand-holding and walking them through the process of how to do it. Because initially, first try, they may not know who to call, where to call, or anything like that. So the parent and the caregiver are definitely encouraged to provide support to the young adult with this process initially. Our transition tracking and monitoring process, again, the social worker continues over time to just continue to meet with the young adult, really getting to know them, really assessing where their strengths are, where they need a little bit more support and assistance. And again, our age of transfer is typically age 21. However, ideally, it's 21. That is not always the case. We do have young adults that are in our PEACH program that are 22, 23, or 24 years old that are still in the pediatric program. Every patient is different. Every patient's needs are different. Every patient's developmental skills and levels are different. So we can't, it's not a cookie cutter process where we treat every single patient the same. We really have to individualize the transition planning process per each patient and family. Again,
你真没见过黑社会哈？敢不敢让你妈？
Who is this guy?
Not sure. Sorry about that, but I kicked him out.
I was gonna say, how did we get him out of there? Because he's crazy.
Yeah.
All right.
Yeah.
Wow. That's amazing.
Sorry about that, everyone.
I told you, hackers. Earlier.
Yeah. Well, you see, my screen isn't flickering anymore. I moved to a different room, Felicia. So
Yeah.
that, you know, and I did go in and try to adjust my settings. I was looking at that earlier, and so it looks great. But this guy just came out of the blue, blew me away.
Right.
My goodness. Yeah, but I've heard about that. Everybody, they've been doing that, right?
Yeah.
Zoom needs to put in more surveillance and
filters.
security.
Yeah.
Nadina, well, he had to have filled out the AEP form, correct? So we can probably find the email and just block them. Yeah. Oh, you're on mute. Nadina, you're on mute.
I said I didn't recognize the name, but yeah, I'll go through the registration and we'll make certain that.
Yeah, we can go over it later after. Too.
Okay.
Sorry, Kim.
No, no
Everyone.
worries. I didn't know if that was another, I can't see the faces, so I didn't know if that was another question or what was going on. So transition planning, again, it's important for the social workers and our case managers to be able to help patients identify available and qualified providers. And we want to be able to continue to evaluate transition readiness goals annually, as I indicated, and increasing interactions with the patients until they feel comfortable and ready. I would never actually authorize or approve a young adult who is continually telling me, oh, Miss Major or Kim, I really feel like I'm nervous, I'm not ready for transition. My goal is really to work with my young adult until they're feeling positive and confident about this entire process. And then again, we want to ensure that appropriate communication of all medical needs to the new identified adult provider are happening.